सर्विक्स। अब फॉर्निक्स का क्या इंपॉर्टेंस है? यू नो दैट एक पाउच ऑफ डगलस, लास्ट क्लास में वी हैव डिस्कस्ड, एक पाउच ऑफ डगलस दैट इज फॉर्म्ड बिटवीन द रेक्टम एंड द पोस्टीरियर वॉल ऑफ द यूट्रस, that can be approached through the posterior fornix. मतलब posterior fornix, मान लो if this is the posterior fornix, इसके through if we encroach inside, we'll be reaching up to the pouch of Douglas, and if there is a collection of pus or anything in the pouch of Douglas, so that can be easily evacuated from there. It won't be needed to open the abdomen. Okay, so that's the importance of the fornix. Now coming to the next part, that is the ligaments that are attached to the cervix. The ligaments that are attached to the cervix are, the first one is the Mackenrod's ligament. Okay, Mackenrod's ligament. Then we have the second one. I'll be dealing with each one later on. Abhi naam bas sun lo. First one is Mackenrod's ligament. Second one is pubocervical ligament, and the third one is uterosacral ligament. Okay, so these three ligaments are present in relation to the cervix. Now talking about the arterial supply. देखो यहाँ पे एक हल्का सा नजर आ रहा है यूटराइन आर्टरी. ओके, यूटराइन आर्टरी. देखो यहाँ पे देयर इज एन आर्टरी, उसके यहाँ से जस्ट tortuously moving around, going up to the near the angle, lateral angle of the uterus. और ऊपर से एक और आ रहा है, that is the ovarian vessel. देखो ovarian vessel, ऊपर से ये जो vessel आ रहा है, that is the ovarian vessel. नीचे से जा रहा है uterine artery. They anastomose near the angle. Okay, so they are mainly responsible for supplying the ovary and the uterus along with the cervix. Okay, so that is the arterial supply. Next page. देखो आर्टीरियल सप्लाई के बारे में जब बात करें तो ये एक स्कीमेटिक डायग्राम है. ओके, जिसमें आर्टीरियल सप्लाई नजर आ रहा है. देखो दिस वन इज द यूट्राइन आर्टरी, जो हम लोग प्रीवियस पिक्चर में देखे. दिस इज द यूट्राइन आर्टरी. अब ये यूट्राइन आर्टरी इज कमिंग टू द टू लैटरल बॉर्डर्स ऑफ द यूट्रस. ओके, यूट्रस के लैटरल बॉर्डर्स में आके क्या करता है? इट डिवाइड्स इनटू टू डिविजन्स, एंटीरियर एंड पोस्टीरियर डिविजन, and goes towards the two sides, means anterior and posterior wall of the uterus. वहां से देखो, that is, it continues down and is known as the coronary branches. Okay, now these coronary branches से अंदर की तरफ radiating, you'll be getting branches. Those are known as radial branches. Okay, radial branches देखो muscle layer में they are forming an anastomosis. वहां से फिर anastomosis से again branches come out and they move to form two main branches. Okay, one branch is known as the spiral branch and one branch is known as the basal branch. Basal branch जो आधे रास्ते में ही रुक जाता है. These are the basal, supplying the basal layers. So this is known as the basal artery. और एक artery होता है जो चला जाता है ऊपर की तरफ towards the endometrium, that is known as spiral artery. Okay, now uterus जब पढ़ोगे histology तो you'll be seeing uterus has three layers of muscle, outer, middle and inner. जो spiral artery है that has to cross the inner layer, the inner layer of the muscle. So what happens when there is menstruation, when there is flowing of blood, then outer layer gets denuded, this portion. Okay, वो slough off हो जाता है. फिर क्या होता है कि the inner muscular layer जो होता है that constricts. The inner muscular layer that constricts and that squeezes the spiral artery. Okay, so the inner muscular layer is also known as the living ligature. Very important, इस पर short note आता है. Living ligature क्या होता है? तो living ligature is the innermost layer of the muscle layer of uterus, which when constricts closes the spiral arteries and stops the bleeding. So that is known as living ligature. Okay. So this is about the arterial supply. Now coming to the venous drainage. When we talk about the venous drainage, so someone is waiting. वेट कर रही है. ओके, तो व्हेन वी टॉक अबाउट द वेन, वेन में क्या होता है? द यूट्राइन आर्टरी जैसा है उसका कॉरेस्पॉन्डिंग विल बी हैविंग द वेन्स. सो वी हैव द यूट्राइन वेन्स एंड द ओवेरियन वेन्स. दे विल अल्टीमेटली ड्रेन इनटू द इंटरनल iliac. ओके, दे ड्रेन इनटू द इंटरनल iliac. Similarly, कुछ branches of the uterine artery have anastomosis with the superior rectal artery, and you know that superior rectal ultimately drains into the portal vein. So this is also a site of portocaval anastomosis. Not very significant, but it is there. There is portocaval anastomosis at this level. Talking about the nerve supply दो होता है, ovarian and uterine plexus of nerves that will be present around there. जो splanchnic nerve से आएगा. Not very characteristic. Coming to the lymphatic drainage, which is very very important. ये तुम लोग का एग्जाम में आता है. Next picture, lymphatic drainage क्या होगा? 5. Talking about the lymphatic drainage. Is it visible? Talking about the lymphatic drainage. Is it visible?
Yes, ma'am.
हाँ चलो देखो lymphatic drainage देखो uterus जिस तरह हम लोग पढ़े थे rectum में it was divided into various sections उस तरह uterus also is divided into sections. Okay देखो यहाँ पे एक section है and यहाँ पे एक section है. Okay so this part is the body and the fundus part. The body and the fundus part से देखो where it is ultimately going, it is going and draining into the para-aortic lymph nodes. Okay, अब देखो just after that the ampulla portion, the most dilated portion of the uterine tube, this portion, यहाँ से देखो it is draining where? It is draining into the superficial inguinal lymph nodes. Okay, so superficial inguinal lymph nodes अगर enlarged है तो वो rectum का भी pathology हो सकता है. Last time we have studied, and it can be a pathology of the fallopian tube also. Okay, so that is about these two. Coming to the next part, mid of the body से एक और section हम लोग काटे एक और portion में divide करते हैं. तो the lower middle portion rather I should say, or the lower portion वो कहाँ drain करता है? देखो it drains into the this group of lymph nodes, and that is external iliac group of lymph nodes. Okay, so middle portion drains into the external iliac group of lymph nodes. Now talking about the cervix, ये वाला cervical portion हो गया, सबसे lower most portion. इसका 3 routes होता है. It can either go to the sacral nodes, as you can see in the diagram, this one. It can go to the sacral nodes. Otherwise, it can go to the external iliac, ये वाला route, or it can go to the internal iliac. Sorry, internal this one, external this one. Okay, so it can drain to either the 3 of them. Now talking about the vagina, साथ में vagina का भी diagram बना हुआ है. Vagina is divided into 2 parts. Upper part से drains into the देखो external iliac, and lower part से it drains into the external iliac. एकदम outermost part से it is draining into the superficial inguinal lymph nodes. तो diagram बना ही हुआ है. You can get the lymphatic drainage from here. Now talking about the next part, very important. That is ligaments of uterus. Okay, इस पे questions आता है. It is important for your viva also. Talking about the ligaments of uterus, blank page ला दीजिए. जी blank page ला दीजिए. Now talking about the ligaments. Now ligaments of uterus are divided into 2. One is known as false and one is known as true. When we talk about false ligaments and when we talk about true ligaments, सबसे पहले let us talk about the true ligaments. Okay, true ligaments are nothing but fibromuscular bands. मतलब they are originally fibromuscular in histology. Fibromuscular bands, whereas false ligaments are nothing but peritoneal reflections. Okay, so there are 2 types of ligaments, true and false. True is fibromuscular band made up of fibromuscular bands, and false is peritoneal reflection. Now talking about the true ligaments. True ligaments का definition बता दिए. What are the true ligaments? The first true ligament is the round ligament. Round ligament. When we talk about the round ligament, it is a ligament जो तुम लोग देख चुके हो. It was starting from the angle. Okay, it starts from there. It is around 10 to 12 centimeters long. Okay, now what is its root? It comes out from the angle of the uterus or the lateral angle of the uterus and moves laterally. Laterally move करके it reaches the lateral pelvic wall up to the deep inguinal ring. On reaching the deep inguinal ring, it then moves forward along inside the inguinal canal and then reaches the superficial inguinal ring. ये है उसका course. So if you are asked about the course of the inguinal ligament, it starts from the angle of the uterus, then moves laterally to the lateral pelvic wall, comes close to the deep inguinal ring, enters into the inguinal canal, and then comes out through the superficial inguinal ring, and it is ultimately inserted into the labia majus. Okay, so that is the root of the round ligament, and that is the length. Now talking about the second true ligament, it is known as the McEnroth's. MACKENRODT''S. McEnroth's ligament. McEnroth's ligament is nothing. Achha, one more thing I have to tell you, round ligament are 2 in number. Okay. Now talking about McEnroth's ligament, this is also 2 in number on both the sides, right and the left side. So McEnroth ligaments are ligaments which are attached to the lateral wall of the cervix, and they go and ultimately insert into the lateral wall of the pelvis. Okay, McEnroth's ligament are also known as the cardinal ligaments. Cardinal ligaments of uterus. Okay, so that is about McEnroth's ligament. Lateral wall से निकल के pelvic cavity का inner wall पे it goes and attaches. Next, the third one is pubocervical. Now talking about pubocervical ligament, नाम से पता चल रहा है pubis से लेके cervix तक होता है. So it starts from the posterior wall of the pubic bone, passes below the urinary bladder, मतलब infralateral surface of the bladder, and goes and attaches to the cervix. So that is pubocervical ligament. I will be showing you one diagram later on, जिसमें तुम लोगों को और अच्छे से समझ में आएगा. And the last one is fourth one. Pubocervical ligament is also 2 in number. Then the last one is uterosacral ligament. Uterosacral ligament, it is also 2 in number between the uterus and the sacrum. Sacrum ka kis S3 level mein goes and attaches. It starts from the uterus lateral posterior surface and goes and attaches to S3. So these are the 4 true ligaments. Ab dekho how many true ligaments you get? 2 plus 2 plus 2 plus 2. So we say true ligaments are 8 in number. 8 in number. Okay. So true ligaments are 8 in number.